So shoulder arthritis.
Ooh, that sounds painful.
It is painful.
Ow.
It is painful, and it's noisy. I mean, people
yeah.
they can hardly lift their arms, and it makes so much noise.
Yes.
If you're one of those people with those crunchy shoulders, got to listen to what we're going to talk about.
Yes, absolutely.
Yeah. No, and here's what I'm excited about. There was not a lot of evidence. For years, I was thinking, what can you do for these people?
And when shoulder replacements started, they weren't that good either.
Yeah,
so there wasn't a lot to do, right?
There really, not that much. And, not everybody wants the surgery. And until 2016, with the study we're going to talk to you about, pretty much if you went to the guidelines, it said, just do what you can do, stay in this range down here, and just sort of live with it.
Yeah.
Yeah, that's pretty sad.
That is pretty sad,
Yeah,
right? Just do what you can do and manage.
Right. So this study done in 2016 in orthopedics by Kibler did a conservative approach. And what Kibler found, and here's what's really important, is people needed to do it for 12 months.
Wow.
Yeah. I mean, people think, you'll get better in 1 or 2 visits. Well, particularly for this, it takes a while.
I love that they emphasize the length of treatment needed to actually show improvement, because the body makes changes, but it needs time. Yeah. And we often don't we don't give it the time. We want to go now.
Right.
So that's an excellent point.
That's a great point. And what's also kind of cool is it's not just shoulder movement. They put in the trunk, and they did all kinds of things. So they followed these people for 3 years, and found that they had less pain, better function. So if you're not a candidate for surgery and you want to do something, here is one program you can do. So Dana's going to show you all the different exercises. I'm going to step back and let you take over.
I'll show a few of the exercises, and I think the key part, like you mentioned, this is like not just thinking about the shoulder. So your shoulder is what we traditionally think about, your arm here and here, but it also is on your shoulder blade, right in this area. That moves so much. And so this study shows if you increase some of the motion in the shoulder blade, you're going to improve function. So that's the starting point of these exercises. So the first one, and you're going to think, why is this my shoulder? But it does relate to how your shoulder blade moves. You're going to think about moving your whole shoulder blade and your trunk into extension. Often when we have pain in the shoulder, and you see this all the time, people hide and they kind of hunch into the pain because it hurts. The idea is get out of this posture, this guarded, protected posture, into an extended position. So literally, you're going to take a functional movement, which is standing on one foot for the first exercise, and practice standing tall and pulling your shoulder back. Yeah, and that actually will help your shoulder. So you're going to stand on one leg.
See all your muscles.
Yeah, see, and they're all engaging, pulling back. So, and it feels good. You can feel the difference. Here, when I'm hunched forward, stress on the shoulder, right?
Right.
When you stand up, it takes less stress on the shoulder, and you're starting to increase some of that mobility through the whole shoulder girdle. So that's exercise number 1. If you can, stand on one foot and try to do like 10 extensions back. Each foot on the shoulder that's involved.
And even if you can't stand on one foot, you could do a kickstand. Just sort of put one toe down and then do it.
That's a great point.
Yeah, if they can. I mean, it's not the protocol, but it's a way to get started.
Absolutely, because the important part's moving back. The second thing is taking that into a step up. So I'm going to sneak over here, and I'm going to use this little yoga block as a step. But you can do this just on your staircase. Same thing, one foot goes up. As you step up, you're leaning back, and you're pulling your shoulders behind you and back down. Up, lean back, shoulder blades back behind you. So 10 times on each foot. As you're able to, add a second set in. The third one you're going to do is coming to the wall. You're going to put your hand on the wall, and you're going to do what's called a clock. So if you just think about the numbers on the face of a clock, you're going to move your hand to hit 12, 1. She's going to be my clock. I love it. So we're going to go up 12, 1, 2, the whole way around. And as you're doing that, you're moving your shoulder through many ranges of motion and your shoulder blade. And you can start low, because if you have arthritis in your shoulder, you're probably going to be down here doing the same type of motion. And that's okay. And as you get a little bit more mobility, you're going to come up a little bit higher. And again, when you do that, think about moving not just at your arm, but you're moving that whole shoulder blade.
Yep.
You got it.
Great.
You got it. Perfect. And then the last one is what we call They call them a shoulder dump, where it's like you're taking maybe a glass of water and you're dumping it over your shoulder behind you. So you're doing this big combined motion. Yeah, exactly. So you're starting down across your hip and you're using your whole trunk, rotating down, and then you're rotating back to like throw the water behind you over your shoulder. And again, it's about moving from the center of your body and then even through that shoulder blade. And as you're able to, you make the movement a little bit bigger. Start with about 10 repetitions. As you can, add a second set, and then you can even add a weight to that. Maybe a 1 pound building up to 2 or 3 pounds. So that's the protocol.
That's a great one. It's a great one to start with, for sure.
Oh, I love it. Yeah. So give that a try. Let us know what you think.